They were denied service. So people were dying. And those who had even been admitted to hospital, and say mothers in labor, women in labor I should say, when they had been delivered of say children, time came for them to be discharged. Not until they paid or their families came to more or less pay what I describe as the ransom money. They were kept there indefinitely till the money came.
Among other things, my mandate, without any equivocation, was to prepare a policy document and also legislation, because we decided that we would bring the health insurance by legislation, not by any administrative fiat. So I was to do all those things and then make sure that Parliament passes it, and then also go into implementation mode.
It was very difficult. People shouldn't forget the economy was in HIPIC, highly indebted poor country, with so much indebtedness. So it wasn't like the state was well off. The state wasn't well off. But then, what was government there for, if not to help the citizens to live? And health must be given priority always. So we stepped in to enable citizens to access. And those who had even been admitted to hospital, and say mothers in labor, women in labor I should say, when they had been delivered of say children, time came for them to be discharged. Not until they paid or their families came to more or less pay what I describe as the ransom money. They were kept there indefinitely till the money came.
Among other things, my mandate, without any equivocation, was to prepare a policy document and also legislation, because we decided that we would bring the health insurance by legislation, not by any administrative fiat. So I was to do all those things and then make sure that Parliament passes it, and then also go into implementation mode.
It was very difficult. People shouldn't forget the economy was in HIPIC, highly indebted poor country, with so much indebtedness. So it wasn't like the state was well off. The state wasn't well off. But then, what was government there for, if not to help the citizens to live? And health must be given priority always. So we stepped in to enable citizens to access healthcare affordably.
But because of our system had never been practiced before, remember putting the informal sector at the center stage, there were some Western governments, which I cannot name, who even initially fought against the concept.
And that's...
And even they went, look, but that is where the politics in me comes into play. Because through my interaction with them and my officials interacting with them, I was advised that if we do not take care and they get the ear of the president, this whole structure will not, the president might not accede to it, and we may not be able to use the concept as we know it now.
The concerns were that, having accepted it was a good idea, was it going to be sustainable? Sustainable in terms of financially? Sustainable financially meaning, is it going to be tax-based? Was it going to be premium-based? And if a premium-based, was the economy strong enough to support and contribute enough? Would people accept? The colleagues, on the presentation of the facts and the studies and the evidence then, seemed to think that it was doable. Doable in the sense that the disease burden of the nation at that time, excluding the non-communicable diseases, quantified and aggregated and translated into financial burden, they thought it was doable. So it wasn't difficult to really buy into it. They bought into it to the extent that we had our own public organized lecture, and then we even devoted a whole annual general meeting held in Sunyani to the National Health Insurance. I was then president. I was going to hand over, but my last AGM was devoted to this. And the whole association swam behind the National Health Insurance.
So the bill that went to Parliament on health insurance needed dissemination across the country. So Deputy Minister in charge of that area at the time, I had to go around the country with 2 committees in Parliament, Health and Finance. We toured the entire 10 regions at the time, and I was speaking on the bill.
At least we had played our parts, we had laid the foundations, and the people had come to accept it. Ghanaian people, like when I say the people. And so if you like, the sustenance of the insurance scheme became a necessity for parties to address through their manifestos. So whoever took power of necessity would have to continue with the policy. So we are proud that we laid the initial foundation.
Having biometrically registered 23 million people, that is 77% of Ghana's population, is in our database. So it's about letting them understand the benefits of staying active. We are also linking up with the National Identification Authority, that is the Ghana card. Once the 2 of us come together as a force to deliver healthcare, we will reach the 80%. Well, we did some research that showed that one of the barriers to renewing was how long it took to have to go to our district office and renew every year. Our survey showed it's an average of 11 hours queuing. And then the transport costs, it's around 5 cedis per person to get to our office and renew and go back. That was becoming a barrier. And when we talked to the members, they said they want to do it themselves. That meant we had to think through how we could do it. And the best idea out of several was letting them renew themselves using mobile money. It has been a major game changer for us. Currently, 75 to 80% of all our renewals are done by people on their mobile phone in the comfort of their homes, offices, or whatever. It has been a big game changer. Now we have to link up with a Ghana card, so you can renew yourselves using your Ghana card and going for hospital with your Ghana card. Eventually, we'll be able to have new registrations using the Ghana card. People want to take their destiny into their hands.
insurance card. Will the card cover all costs during my 9 months journey?
Madam, pregnant women do not have to pay anything to get NHIS card. It is free. Your NHIS card covers antenatal care, normal delivery, cesarean session. What you need to do is go to the nearest NHIS district office, show evidence of pregnancy, doctor's report or scan, and get registered or renewed. In an unfortunate incident where you are charged for healthcare services, please insist on a receipt. Contact the NHIA on 054 444 6447. Produce the receipt upon request, and our client and provider relations personnel will investigate the payment and get a refund for you.
I take your hand and lead you to the dance floor. As the music dies, something in your eyes calls to mind a silver screen of dark and said goodbye. I'm never gonna dance again. Guilty feet have got no rhythm. Though it's easy to pretend, I know you're not. The careless whispers of a good friend to the heart and mind. Ignorance is kind, but there's no comfort in the truth. The pain is the harder you'll find. I'm never gonna dance again. Guilty feet have got no rhythm. Though it's easy to pretend, I know you're not. Again, the way I dance with you.
tenderness, and you don't know, you don't even know that I exist. I wish that in your arms, and you would play me through the night till the dawn. Till the dawn, I wish you hold me like that Spanish guitar all night long, all night long. I'd be your song, I'd be your song.
Te sientes entre la gente, cierras tus ojos y sueñas que soy tuya, pero yo no sé ni siquiera que estás ahí.
Me gustaría tenerte en mis brazos, amor. I sit out in the crowd and close my eyes to read your mind, and you don't know, you don't even know that I exist. Spanish guitar, you would play me through the night.
Before I was installed as president of Ghana, and through the elections that brought me to power, we saw that there was no policy for health delivery, and the cynical name given to what was in practice then was cash and carry, which meant that when people didn't feel well and they attended hospitals and clinics across the country, before I was installed as president of Ghana, and through the elections that brought me to power, we saw that there was no policy for health delivery, and the cynical name given to what was in practice then was cash and carry, which meant that when people didn't feel well and they attended hospitals and clinics across the country, and they were even fortunate to get some doctor to examine, diagnose them, they had to pay for services, and where they didn't have money, they were denied service. But the whole idea was to stop the demeaning thing called cash and carry, which was destroying Ghanaians and denying citizenry of the healthcare service. So this was why we did it. Where they didn't have money, they were denied service. So people were dying. And those who had even been admitted to hospital, and say mothers in labor, women in labor I should say, when they had been delivered of say children, time came for them to be discharged, not until they paid or their families came to more or less pay what I would describe as the ransom money. They were kept there indefinitely till the money came.
Among other things, my mandate, without any equivocation, was to prepare a policy document and also legislation, because we decided that we would bring the health insurance by legislation, not by any administrative fiat. So I was to do all those things and then make sure that Parliament passes it, and then also go into implementation mode.
It was very difficult. People shouldn't forget the economy was in HIPIC, highly indebted poor country, with so much indebtedness. So it wasn't like the state was well off. The state wasn't well off. But then, what was government there for, if not to help the citizens to live? And health must be given priority always. So we stepped in to enable citizens to access healthcare affordably.
But because of our system had never been practiced before, remember putting the informal sector at the center stage, there were some Western governments, which I cannot name, who even initially fought against the concept.
And that's...
And even they went, look, but that is where the politics in me comes into play. Because through my interaction with them, and my officials interacting with them, I was advised that if we do not take care and they get the ear of the president, this whole structure will not, the president might not accede to it, and we may not be able to use the, the concept as we know it now.
The concerns were that having accepted it was a good idea, was it going to be sustainable? Sustainable in terms of financially? Sustainable financially meaning, is it going to be tax-based? Was it going to be premium-based? And if a premium-based, was the economy strong enough to support and contribute enough? Would people accept? The colleagues on the presentation of the facts and the studies and the evidence then seemed to think that it was doable. Doable in the sense that the disease burden of the nation at that time, excluding the non-communicable diseases, quantified and aggregated and translated into financial burden, they thought it was doable. So it wasn't difficult to really buy into it. They bought into it to the extent that we had our own public organized lecture, and then we even devoted a whole annual general meeting held in Sunyani to the National Health Insurance. I was then president. I was going to hand over, but my last AGM was devoted to this. And the whole association swam behind the National Health Insurance.
So the bill that went to Parliament on health insurance needed dissemination across the country. So the deputy minister in charge of that area at the time, I had to go around the country with two committees in Parliament, Health and Finance. We toured the entire 10 regions at the time, and I was speaking on the bill.
At least we had played our parts, we had laid the foundations, and the people had come to accept it. Ghanaian people, like when I say the people. And so if you like, the sustenance of the insurance scheme became a necessity for parties to address through their manifestos. So whoever took power of necessity would have to continue with the policy. So we are proud that we laid the initial foundation.
Having biometrically registered 23 million people, that is 77% of Ghana's population is in our database. So it's about letting them understand the benefits of staying active. We are also linking up with the National Identification Authority, that is the Ghana card. Once the two of us come together as a force to deliver healthcare, we will reach the 80%. Well, we did some research that showed that one of the barriers to renewing was how long it took to have to go to our district office and renew every year. Our survey showed it's an average of 11 hours queuing. And then the transport costs, it's around 5 cedis per person to get to our office and renew and go back. That was becoming a barrier. And when we talked to the members, they said they want to do it themselves. That meant we had to think through how we could do it. And the best idea out of several was letting them renew themselves using mobile money. It has been a major game changer for us. Currently, 75 to 80% of all our renewals are done by people on their mobile phone in the comfort of their homes, offices, or whatever. It has been a big game changer. Now we have to link up with a Ghana card, so you can renew yourselves using your Ghana card and going for hospital with your Ghana card. Eventually, we'll be able to have new registrations using the Ghana card. People want to take their destiny into their hands.
I'm a pregnant woman. How much do I have to pay to get health insurance card? Will the card cover all costs during my 9 months journey?
Madam, pregnant women do not have to pay anything to get NHIS card. It is free. Your NHIS card covers antenatal care, normal delivery,
Ladies and gentlemen,
cesarean section.
good morning. We
What you need to
welcome
do is
the presence
go to
of
nearest
the
NHIS
First
district
Lady
office,
of
show
the Republic of
evidence
Ghana,
pregnancy,
Her Excellency
doctor's report or scan.
Rebecca Akufo-Addo. Kindly be on your feet, please. Good morning, Madam First Lady. Welcome to the launch of this year's NHIS Week. And she's just received a bouquet from Nita Akofa Kudalo. Thank you. Thank you very much, distinguished guests. Ladies and gentlemen, welcome to this beautiful environment where we are here to launch this year's NHIS Week. My name is Kafui Day. Pleasure to be your MC for the occasion. Our theme is on NHIS, using the Ghana card for expanding access to health care. We want to start with an opening prayer. It's my pleasure to call on Mr. Collins Ekuamwa from the National Health Insurance Authority to do the honors for us. Mr. Ikoma, for the opening prayer, please.
Shall we pray? Our Heavenly Father, I want to thank you this morning. We give you all the glory, we give you all the honor, we give you all the adoration. Thank you once again for bringing us together to celebrate NHIS. Thank you for all the good things you have done for us, and thank you for travel mercies to this very important meeting. We invite you to be in our midst this morning as we begin the program. We pray that you will lead us throughout this session. At the end of it all glory and honor shall be given to your name. We thank you, we bless you. In Jesus' name, amen.
Thank you very much, Mr. Ikwamwa. Our chairman for this occasion is a government appointee as an assembly member with the Accra Metropolitan Assembly. He was educated at Adisadel College and as well as Accra Academy in Ghana. And of course, he went to school in Wayne County Community College in the US of A. He is privately known as Mr. Samuel William Ni Akrashi Nunu. He is also the Atofuche of the Ga State, and he's representing the Ga Manche today. Let's welcome our chairman, Ni Ahene Nunu III, Abola Manche, and Ga Atofuche. Ni chairman.
Good morning. Your Excellency, the First Lady of the Republic of Ghana, Mrs. Rebecca Na Okainko Akufo-Addo, Honorable Minister of Health, Board Chairman of the NHIA, Chief Executive Officer of the NHIA, members of the Diplomatic and Consular Corps present, Nime, Name, distinguished invited guests, staff of the NHIA, ladies and gentlemen, good morning. Let me begin by apologizing on behalf of the Royal Majesty King Takite Kochuru II, the Gamanche, who due to the grave emergency is unable to be present with us this morning to chair this very important and august function. But he sends his very best wishes for a successful event. I would like to thank the NHIA for the honor and privilege of allowing me to chair this function. I feel humbled that I am chairing such an important event and extend my warm welcome to you all. The National Health Insurance Scheme is arguably the most important social intervention scheme in Ghana. As we all are aware, the scheme was established under the Health Insurance Act of 2003 to provide universal health insurance for the good people of this country. The scheme has been lauded by many people nationally and internationally, and most recently was lauded as a shining model in Africa. Its various achievements, notwithstanding the challenges, which have also been applauded by the Gamanche King Takite Kochuru less than a week ago. And it's evident that a lot of Ghanaians continue to rely on this scheme for their healthcare needs. I'm reliably informed that today's launch and the week's program will seek to increase the membership base of the scheme. These are found laudable and timely in the light of the various health challenges we continue to encounter, not least the current COVID-19 pandemic. It will thus be beneficial to all. As they say, health is wealth, and so a nation's wealth is the health of its people. This is why I argue all stakeholders to give maximum support to the scheme and to the WICS program. Let me take this opportunity to express my appreciation to the board, management, and staff of the NHIA and Herculean task they are performing, and wish them success in their endeavors to ensure a healthy nation. Your Excellency, the First Lady, distinguished ladies and gentlemen, I wholeheartedly accept the chair this very important occasion and hope that with this support, we will have a successful launch of the 2021 NHIS Week celebration. Thank you for your attention.
Thank you for reminding us how important health insurance is. Thank you for your remarks, and thank you for accepting to chair this event. We'll now hear from our Chief Executive Officer. Let's welcome the Chief Executive of the National Health Insurance Authority, Dr. Lydia Chani Selby.
Good morning, everybody. Her Excellency, the First Lady of the Republic of Ghana, Mrs. Rebecca Akufo-Addo, Chairperson Ni Ahene Nunu III, Abola Manche, and Atofoche of the Ga State, representing the Ga Manche, Minister for Health, Honorable Kwekwa Jimamenu, Ministers of State, Members of Parliament here present, members of the Diplomatic Corps, the Board Chair and Board members of the National Health Insurance Authority, the Deputy CEOs, management and staff of the National Health Insurance Authority, colleagues from agencies within the health sector, development partners and sponsors, Nime, Name, Nananum, our media friends, invited guests, ladies and gentlemen. It is my pleasure to welcome you all to the launch of the 2021 NHIS Week celebration today, particularly the First Lady, for taking time out to be present here with us. We are very grateful. The NHIS Week celebration last year marked the maiden edition, and this is the second of many more to come. It is a week where we aim to celebrate the relevance of the scheme, project our progress, and chart a way forward with the goal that all residents in Ghana will have access to health care under the National Health Insurance Scheme. The week-long celebration last year provided us with an opportunity to register and renew 750,000 people within that week alone. It was indeed a successful event, even in the midst of the COVID-19 pandemic. The theme for this year's NHIS Week celebration is NHIS, using the Ghana card for expanding access to healthcare. In this era of technological advancement, it is laudable that the MPP government, led by His Excellency Nana Addo Dankwa Akufo-Addo, is focused on leveraging the use of IT to create efficiencies in the way the government does business. Over the next 1 week, our dedicated staff across the country are committed to making this year's celebration even better, as we hope to achieve universal health coverage in Ghana sooner than the target date of 2030. The National Health Insurance Scheme remains a cardinal instrument in the provision of comprehensive healthcare services to all the residents of our country. The extent of this service provision, however, is entrenched in our ability to increase membership and to expand availability of accessible quality healthcare services. The NHIA began its campaign to increase NHIS membership last year when the linkage of the NHIS card with the Ghana card through mobile technology was successfully introduced. We saw then and continue to see renewed interest in the National Health Insurance Scheme and are encouraged by the numbers that have already made the link. This year, we continue with the momentum from this digital innovation to rigorously include every resident with a Ghana card onto the NHIS. We have thus deployed several media campaigns to encourage all residents to renew their membership onto the NHIS and to do so with ease using the Ghana card. Our NHIS week is also dedicated to this goal, and our district, regional, and national offices will be championing this cause. It will be unfortunate for us to capture a large majority of the population onto the scheme and yet have inaccessible or inadequate healthcare services. As such, the second key element in expanding access to healthcare is to provide an extensive array of healthcare services to members of the scheme. The authority seeks to expand service provision through evidence-based and data-driven modifications to the NHIS benefit package and through continuous engagement with key stakeholders of our health system. We are at liberty now to make such modifications due to the rich data stores we have accrued over the years, as well as the rigorous research conducted by the various directorates in the authority. At this opportune time, the linkage of NHIS membership with the Ghana card further provides the opportunity to plan such preventative healthcare services and to make these services available to NHIS members. Coupling accurate information on the demographic characteristics of Ghanaians, together with the common disease conditions prevalent in the country, we can provide a context-appropriate preventative benefits package, which caters to the needs of most of the population. Such preemptive actions reduce the disease burden, assure confidence in the health system, and eventually result in a healthy and productive nation. We are therefore at the crossroads of a strategic moment in history, and the NHIA is determined to progress healthcare above and beyond what has ever been established in sub-Saharan Africa and beyond. Actuarial modeling done indicates the capacity of the NHIS to expand the benefit package to include some interventions and still remain buoyant. In tandem with the above, we have expanded our benefit package with the introduction of new healthcare services for members of the NHIS, but we remain mindful of our duty to ensure sustainability of the scheme. We encourage all residents to enroll on the NHIS and especially urge all inactive members of the NHIS to renew their membership to enjoy these benefits. We call on the inherent philanthropic nature of citizens and residents of Ghana to take up the responsibility of renewing NHIS membership for friends, family, and individuals within our social networks. We also implore religious bodies, civil society, corporate entities, and indeed everyone to organize renewal parties where the cost of NHIS membership is catered for. We cannot stress enough the essence of healthcare and its availability to all. Recent facility mapping exercises conducted by the authority have highlighted the unfair distribution of healthcare services across the country. We see a polarization of services towards regional and district capitals at the expense of many deprived areas. I take the opportunity to encourage all healthcare providers, especially those seeking to establish new facilities, to situate them in underserved areas for fair distribution of healthcare services. The authority will do its best to recognize such noble acts and assist in your credentialing, should they meet the set standards of the NHIA. During the NHI's week, I wish to reiterate the need for the guardians of the NHIS, what we call the golden tripod of members, healthcare providers, and the authority, to diligently advocate for innovations that improve and sustain the NHIS. It is a responsibility we should not take lightly and a privilege we should hold dear. Thank you very much.
Thank you, Dr. Janice Selby, CEO of the NHIA, for your warm words of welcome and your reminder to us of how important this business is of getting all of us onto the National Health Insurance System. Thank you. This event is going out live on NHIS TV on YouTube, as well as NHIS's Facebook page. So tell a friend to tell a friend that they can watch what's going on live from their phones. We shall now hear from the board chair of the National Health Insurance Authority. Let's welcome Dr. Ernest Kojopuni Kwaku.
Lights have been dimmed.
Yeah, they've been dimmed, right? Yeah. If the lights can come up, it'll be nice. It's a bit dim now.
Your Excellency, Mrs. Rebecca Akufo-Addo, First Lady of the Republic of Ghana, Ni Ahene Nunu, the second, the third, representing the Gamanche, the Minister of Health, Honorable Koko Ajimamenu, members of Parliament here gathered, ministers, board members of the National Health Insurance Authority, CEO and Deputy CEOs of the National Health Insurance Authority, management and staff of the National Health Insurance Authority, our development partners and sponsors, Nananum, Nime, Naime, friends from the media, distinguished ladies and gentlemen. I warmly welcome all of you to this week-long celebration of the National Health Insurance Scheme under the theme, National Health Insurance Scheme, using the Ghana card for expanding healthcare access. On behalf of my colleagues, I'd like to take the opportunity to thank His Excellency, the President of the Republic of Ghana, Nana Addo Dankwa Akufo-Addo, for the confidence reposed in us to steer the affairs of the 2021-2024 Governing Board of the National Health Insurance Authority. It's our turn to add on to the scheme's successes, and in that regard, we pledge to devise strategies that will ensure the sustainability of the scheme, its challenges notwithstanding. Our board was inaugurated on the 8th of June this year, and we were charged to support the operations of the authority on its way to achieving universal healthcare coverage by the year 2030. It has been 18 years since the inception of the scheme. The scheme has come a long way, and I say aiko to all our predecessors for their contributions to the NHIS achievements thus far. I would like to commend the President and his team for leading us on the pathway to a digitized economy, including the linkage of the NHIS card to the Ghana card. As the theme suggests, NHIS using the Ghana card to expand access to healthcare, we would like to ride on the back of this one-stop digitization agenda to drive up our regional and district membership levels. The Ghana card, as we know, will soon be the sole form of identification and access to social services. And for that reason, the National Health Insurance Authority has taken steps in making sure that this happens by creating the mechanism to enable linking of the NHIS card to the Ghana card, which fits very well into the inclusiveness agenda of the government to provide affordable health care to all its citizens. It is worth noting that the President recently commissioning 2 newly built NHIS district offices in Amansia East District in Ashanti region and the Bibiani Anyaso Bekwai District in the Western region. During the commissioning, the President was taken through the process in linking the NHIS card to the Ghana card. And this should be a motivation and an encouragement for us all to do so by dialing *929# and then selecting option 4 to link the 2 cards. The 6 new regions will soon get their insurance administrative complexes to expand their operations. What is key for us today is to leverage the use of the Ghana card for health access. I therefore urge all holders of the 2 cards to do the merger by dialing the short code *929# and use the Ghana card to access healthcare. As we commence the week-long celebrations today, I urge the regional and district management teams and staff at all levels to ensure that there's increase in the scheme's active membership. Accept my warmest welcome to today's launch, and I thank you very much.
Many thanks, Board Chair of the NHIA, Dr. Kwaku, for your remarks. We'll now hear from the Honorable Minister for Health. Let's welcome Honorable Kwaku Ajiman Menu. MP. Very important.
Thank you very much, Mr. MC. Her Excellency, the First Lady of the Republic, Mrs. Rebecca Akufo-Addo. Ni Chairman and the Abola Manche, representing the Gamanche. Honorable colleague MPs who are present, the CEO, management and staff of the authority, board chair, and all board members who are also present, our development partners. Let me also mention our agency heads of the health sector who found time to be with us. Distinguished invited guests, ladies and gentlemen, let me also greet you properly good morning. I am delighted to be here with you for the second National Health Insurance Scheme Week celebration under the theme NHIS using the Ghana card for expanding healthcare access. I think you agree with me that we have everything to celebrate about. Why do I say so? Ghana's health insurance scheme has become a model in sub-Saharan Africa. Wherever we go and we are talking about health financing, it is Ghana that everybody points hands to. And I think this is a tremendous achievement. Not only that, we are also succeeding in digitizing the entire spectrum of operations within the authority. And that is also a very big plus. Our assessments indicate sustainability of the scheme if we're able to do a few more things. But we are on course in getting these things done. We cannot sit down for the authority to be run down. So our sustainability has been confirmed, and we continue to work as hard as we can to continue to sustain what will give access to a very vulnerable and poor in society, access to healthcare. In line with the National Digitization Agenda, this ambitious agenda will contribute immensely to government's commitment to make quality healthcare services accessible and affordable to all residents in our country. The maiden edition of the NHIS Week celebration was commemorated last year. And I think I told you that within the period, the authority recorded 302,000 actual new members onto its database. A total of 748,884 registrations and renewals were recorded, which was considered as a major boost. Distinguished ladies and gentlemen, this government, upon assumption of office in 2017, has consistently been supporting the NHIS operations. Government commends the NHIS management over the recent prompt payments of claims to credentialed service providers to keep them in business. And I also commend our President and the Minister of Finance for ensuring that they give us what we need to take to be able to do the work we are doing very, very, very well. The President, as part of his regional tools, recently opened 2 new desk offices for the NHIS in the Amansia East district in the Ashanti region and the Bibiani Amiasu-Bekwai district in the Western North region. Apart from taking care of the sick, NHIA, the authorities also assisting government in expanding facilities. And where they work shouldn't be a burden of the state any longer. They are working on that. And that is a demonstration of what investments they are making to ensure that they have people working in very hard-to-reach areas of our country to enable them access healthcare. Government's Agenda 111 initiative is on course, and it is obvious that our commitment to achieving universal health coverage is not a mere rhetoric. We will deliver our promise of bringing primary healthcare services to the doorsteps of our people without fail. Her Excellency, NHI Chairman, I commend the NHIA again and the Rebecca Foundation for joining forces to raise awareness on childhood cancers and the inclusion of Herceptin on the NHIA drug list to support the treatment of breast cancer. I am delighted that the National Health Insurance Authority continues to introduce new innovations to expand the NHIS operations. Notable among these innovations is the introduction of the mobile renewal platform, which has helped a lot of people to do self-renewal of their expired NHIS cards. The ongoing merger of the NHIS and Ghana cards is commendable, and I urge all holders of the two cards to do the merger now and use one card to access healthcare. What is key for us today is leveraging on the use of the Ghana card for healthcare access. As a government, we will continue to ensure that the NHIS finances are released on time to solve the problem of unpaid bills to healthcare providers. The smooth operationalization of the National Health Insurance Scheme is government's major priority. Distinguished ladies and gentlemen, I would like to wish you a joyous NHIS Week celebration across the country. But before I sit down, let's remind all of us that we need to take COVID vaccination very seriously. We now have doses in town, all districts, every village, and wherever you are. If you are not vaccinated, please find a way to get a jab. We are now taking outreach teams virtually into all gatherings. So find yourself a jab to protect yourself and the rest of us. If you have done yours, get to your next neighbor, either at the church room, in your home, wherever you are at the workplace, to ensure that you are encouraging others to take vaccination very seriously. That is the only way we can protect this country from COVID-19 spread. I thank you very much.
Thank you for your remarks, Honorable Minister for Health, and for the reminder that the COVID vaccines are available for the unvaccinated. You need to get vaxxed. And for those of you who are curious about his constituency, it's Doma Central in the Bono region. Thank you very much. We have two videos we want to show you. The second one will deal with family planning, but the first one is a documentary, short one, on childhood cancer. So please listen and watch. Childhood.
Childhood cancer occurs when there's an abnormal growth of cells in any part of the body, and this affects the normal functioning of the child. There are several types of childhood cancers, and the commonest are the leukemias, the lymphomas, the eye cancers, or in other medical terms, retinoblastoma, and kidney cancers, also known as Wilms tumor.
Childhood cancers occur between birth and 14 years of age. Globally, there are about 175,000 new cases annually. They differ from adult cancers in the way they grow and spread, how they are treated, and how they respond to treatment. Childhood cancers can be cured. In high-income countries where comprehensive services are generally accessible, at least 8 out of every 10 children with cancer are cured. Can same be said about Ghana? Here is Dr. Lawrence Osetutu, who is a pediatric cancer expert at the Konfanochi Teaching Hospital in Kumasi.
Currently, globally, if you take 10 kids who have cancers who are less than 18, 8 to 9 of them will get cured. So it's not a disease that should kill children. And currently in Ghana, we are looking at maybe 3 out to 4 out of 10 that will get cured. So if you want to push it up to 6 out of 10 or more, it is achievable.
Childhood cancer data systems are needed to drive continuous improvement in the quality of care and to inform policy decisions.
We've already established that cancer occurs in people of all ages and can affect any part of the body. It begins with genetic change in single cells that then grow into a mass or tumor, invades other parts of the body, and causes harm and death if left untreated. Dr. Vivian Pintel, head of Pediatric Oncology Unit at the Konfanochi Teaching Hospital, tells us how we are dealing with childhood cancer.
For childhood cancers in Ghana, mostly is being treated by individuals. It's currently being treated by individuals, by parents out of pocket. And occasionally we have a few philanthropists who help. We know that children, they are all under 18 and they are properties of the state. And so the state should be able to take up the treatment for these children who has cancer. But currently, it doesn't happen like that.
Because it is generally not possible to prevent cancer in children through screening, the most effective strategy to reduce the burden of cancer in children and improve outcomes is to focus on a prompt, correct diagnosis followed by effective, evidence-based therapy with tailored supportive care.
Some of the signs and symptoms of childhood cancer may mimic normal childhood illnesses. However, if your child develops, especially infants, if you notice a shiny white spot in the eye, or the child has difficulty with vision, or you notice a bulge, a swelling of the eye, you should have the child reviewed because it could be a form of childhood cancer, retinoblastoma. If the child, you notice lumps on the child's body, any swelling, any part of the body, it could be the stomach, it could be the legs, the arms, or the head. It could be a form of childhood cancer. If there's anything unexplained, like unexplained prolonged fever for more than 2 weeks, or the child is anemic, or the child becomes very weak and is not responding to normal treatment, the child has to be reviewed because it could be a form of childhood cancer.
In 2018, the World Health Organization launched, together with partners, the Global Initiative for Childhood Cancer to provide leadership and technical assistance to government to support them in building and sustaining high-quality childhood cancer programs. The goal is to achieve at least 60% survival for all children with cancer and reduce suffering globally by 2030.
It is achievable. Whatever that means is that we must have a clear focus on the challenge of childhood cancers, have clear policies, have clear guidelines, have clear investment, sustainable source of funding, have training and retraining of healthcare personnel, be able to identify these cancers early so that their treatment will become cheaper instead of having children come to us with far advanced diseases that require a lot of investment and money to be able to cure them. So if we are able to do these things, catch them early in the early phase of the diseases, diagnose them correctly and accurately, and offer them comprehensive care in a timely manner, I think it's a very low-hanging fruit. 6 out of 10, 60% for about 6 very common cancers that affect the blood, the lymph glands, and other common parts of the body like the eye in children. This is a very doable effort.
In 2003, Ghana initiated a national health insurance scheme, but 18 years later, childhood cancers are still not covered. This compelling situation explains the NHI's intention to include the diagnosis and treatment of childhood cancer to the NHI's benefit package.
So childhood cancers is, whether we like it or not, it is something that will always be with us. And what we need to do is to make sure that we detect it early so that the children can have a good outcome. Because for childhood cancers, if we are able to detect it early, between 80 to 85% of them can be cured. When we say cured, it means that the patients are treated, they are cured, they have the rest of their life to serve the country. And so what we need is to be able to detect them early. So first comes with education, where the populace will need to be educated about all the early signs and symptoms. And then we have to have strategies where when the parents bring the patients early enough to the hospital, they are able to be navigated so smoothly throughout the system that wherever they find themselves, they can't get some sort of care. And then when they get to the comprehensive centers, they should be able to have free treatment, or even if it's not totally free, some sort of treatment so that, and some support so that they can be able to finish treatment.
Family planning is basically in enabling couples and individuals to have the necessary information based on informed consent, to decide how many children they want to have and how the spacing will be.
Generally, we use contraceptive methods to help them do that, and also we help people who want to have children to also have children. So family planning is both preventing pregnancy and helping those who want to have children also to have children. Family planning, we say, saves lives and is very important in family health. Family planning empowers the woman. If you look at the family, the woman is very key in the day-to-day running of the family. And family planning, we say, prevents maternal deaths. If you use family planning the way we're supposed to use it, then we believe that family planning alone can reduce maternal mortality by 40%.
If women have that power, or couples have the power to decide, their own health is improved, and so has benefits for family insurance. If more children are born and they are all sick and there's a lot of sickness, it has implications on our insurance, and so it has inherent benefits on both sides of the family and the scheme if they support them too. Well, the cost implications will be, one, the cost of delivery of service, two, the people, maybe procurement of supplies and some commodities that will have to be procured. And so these are areas that we do so. But if you're on the flip side, if you look at the overall benefits, the scheme will make more savings making that investment.
Family planning, we think, if it's covered by NHIA, in the long run, is cost effective. The initial cost, because once we put it on NHIS, just like we did with general services, outpatient attendance increase, we expect that initially there will be an increase. But that is good for us, because if people are using contraceptive methods and family planning services, then in the long run, unsafe abortion will go down, because NHI covers management of abortion complications. Unsafe abortion will go down, maternal mortality will go down, complications will go down. So the money that we are using to manage these things will be saved in the long run when we are able to prevent those pregnancies. Family planning costs will be about 25.9 million annually, but at the end of the day, it will save the country 46.5 million annually. So if you look at the balance, then we'll be saving money, even though the initial cost may be high.
Yes, even though family planning services are currently subsidized, to some people that is still a high price. In the open market, some of the commodities are much higher, but this will help improve access to them, to reduce the costs, the out-of-pocket payment for these essential services.
The next speaker, who is going to be doing a brief presentation on childhood cancer. Let's welcome Dr. Lawrence Osei-Tutu from the Komfo Anokye Teaching Hospital. Yes, good. There you go. That was fast.
All right, thank you very much. I stand on all previous protocols. That's how they say it, respectfully. I would like to give you a simple crash course on childhood cancers on behalf of my colleagues from the Childhood Cancer Society of Ghana. Let's move on. So it's a crash course. We'll end up with what we think we can do to improve our challenges. Next slide, please. So basically, if you think about the word cancer, it is what it is. Crab, middle portion, you spread. But by the time you see it, the process has started a long time ago. So when they come to you, you're already late. You have to be fast. And strictly speaking, you are looking at the body made up of switches. Like the lights went dim and everybody was, no, it's not time for the light to be dimmed. So in life, when it's time for you to die, you die. Then people replace you. You don't live forever. But in cancers, these switches misbehave because the supervisors, which are the genes, are unable to do their work very well. And that is the basic thing about cancers in children. There's no real cause that you can point to, but we know that these genetic abnormalities with all these so-called hallmarks take place and end up with us seeing the things because they cannot stay within that confinement anymore. So by the time you see it, you are late. Next slide, please. Right, and between children and adults, children, if you think about it, are growing, they're likely to have cancers, but the cancers that happen in them are so aggressive and therefore they multiply, they increase. One, the commonest one we see of the jaw, doubles every 18 hours, for example. And like I said, no clear risk factor. You can't say the child smoked or stopped smoking and you won't get cancer. And it makes it difficult to have screening programs for them. And so treatment has to be very intensive. You lose guard a little bit, the cancer overtakes you. And unfortunately, when it's coming back, it takes a different form, right? And they mutate, and they will not respond to your first treatment, okay? It is coming up in our environment day to day. It is part of the non-communicable diseases. By 2030, 80% of newly diagnosed children with cancer out of 300,000 will be in LMICs like Ghana. The future is cancer. Unfortunately, we are not diagnosing almost half of them. Next slide. And the story is not different. So when we looked at big data from Konfanoche over 15 years, for instance, we know that between Konfanoche and Kolebu, only 1 out of 4 with cancer get to us. 3 out of 4 remain undiagnosed. We can't even know where they are. And when they get to us, only 1/3 complete treatment. 2/3 abandon treatment for various reasons that we will see. There are several types of cancers. Let's go on. And this is how cancers present. By the way, if I asked A, B, C, D, how many of you think, which of them do you think is cancer? A, anybody? B, there's a nasty swelling at the back of the ear. C, huge abdomen, and a beautiful girl. D, you don't find any problem. Well, A, B, C, they were not all cancers. It's only D who died from a cancer, okay? So it is very non-specific. Next slide. If you wait for seeing things, you probably will be late. But unfortunately, we are human. We cannot predict at the subcellular level. So that's how come the video we're mentioning things that you have to look at to draw your attention to it. And by the way, do not wait for pain. Cancers usually are not painful. By the time they become painful, they are so far advanced. Next, let's move on. So there are so many. It's not a uniform thing. There's not like a childhood cancer, which requires only one form of treatment. There are thousands of them that we've said already, of the blood, of the eye, of the kidney, and so on and so forth. These are real numbers from the real data. Let's go on. And unfortunately, we are not doing well currently because of several challenges that we see. For example, between up to 5 years from 2013 to 2017, out of 557, almost 500,000 kids, less than 1/5 actually completed treatment. Less than 100, all right, out of 500,000. And it's all because it takes a lot of time, effort, expertise, resources, money, all right? And unfortunately, currently, many families are paying out of pocket for the cost of services. And beyond that, you need to be followed up in the long term. So if you combine all these things from the biology of the disease itself and the associated factors, it is possible that people are not able to stick to the plan. 2 to 3 years for leukemia, and then they abandon treatment, as we call it. So that has resulted in a disease that is like, for example, let's say common cold in the developed world, and to us, 8%, 80% are surviving to us, only less than 20%. That is the gap. We need to close this gap. Next slide. And the various factors, but one of the key things that people mentioned was the cost of travel, for instance. So there are some organizations looking at the cost of travel, but beyond that, you have other factors which are mainly financial. And for me, the fact that we are missing them, it means that they also come late to us. Next slide. So for me, the underlying, people always think that it is money. It is not. I think the underlying factor is lack of awareness at all levels, policy, through healthcare practitioners, then to the community level. If we know, then all of us will come together to deal with the problem. The limited resources we have to make best use of it. So the academicians have to bring in place research and things for us to get good protocols that are cost-effective but modern for us to be able to use. We need to cut down job losses, because if you have to sell your farm to treat your child of cancer, then that's going to affect our economy. Then we need to find sustainable means of funding and then train people to make their experts available and decentralized care. Next slide, please. Right, so for example, there are cost of labs. If you go down, next slide, next slide, next slide. All these are labs that are done by one person within 2 to 3 years for one cancer, right? And that is just one aspect, which is the burden on these families. So if we have good governmental political leadership, which is here, and there's very sustainable financing with psychosocial support and economic support, all right? So you don't have to abandon your job to be able to take care of your child. Have long-term partnerships. If you look at the facilities partnering, other facilities who have done it before, beautifully done in Brazil where they change their numbers, decentralizing and then coordinating the care appropriately and having access to these basic chemotherapy. Sometimes I'll show you photos that you just swallow a few pills and that's all you need to cure the cancer, but for lack of knowledge. So these are some people I saw actually outside the teaching hospital. He had a cancer of the kidney. Now he's lost the kidney because of the treatment. We give radiation to the lungs and radiation to the abdomen. So that means when he comes back later in life with breathing difficulties, that is what you do when you are treating these kids. Then the next one, another boy who had a common cancer we call Beckett lymphoma, came very sick from our front plains, and now he's doing very well. Just 6 to 8 months of therapy. Well, they are not coming for follow-up, but I hope they are well. Next slide. And I was able to pull him through for him to be able to have a beautiful face to celebrate Christmas. And I lost him to tuberculosis in Navrungo. That's such his life. Next slide. And this is one of my famous ones who swallowed just a couple of pills using very local adapted protocols from sub-Saharan Africa. And we just under less than 1/5 of the cost of 1/10 actually of the cost of breast cancer treatment. You can, so it's a travesty if she should die from this disease. This is apologies for the picture. He came with 2 heads, basically. Then a treatment shrunk it down. Then he had to go home, all right, and to come back later. We sent him money for transportation to come back. Then he sent the money back to her and said he cannot afford to abandon his farm again, okay? So because the child is looking well. But that is the middle of the treatment, and he abandoned treatment because he would lose his farm. And she had to sell, the mom, this beautiful girl, they became paralyzed with this common cancer again. A few pills cured, but had to come back to us. And the mom had to, in Afram place, had to sell contumely to raise 20 cedis. And I asked myself, in Afram place, everybody's growing contumely. So who is going to buy your contumely? Now he gets to us, you see them, how are they going to go back? All right, so we can't cure these kids even outside our teaching hospital. We need to be innovative and we need to have a plan for saving them. Let me say a very big thank you to all these kids. The ones we've lost, those who are still alive, those who cannot account for them, the Chief Executive Officer and the Board Chair and staff of NHIA, all my colleagues here, teachers and mentors, and to all of you for listening to us. Thank you.
Wow, he promised it was going to be a crash course. That really was a crash course. Thank you very much, Dr. Asetutu, for letting us know the severity of the situation, and more importantly, the hope that exists for people who have childhood cancers. They can be dealt with. It's a matter of time. Thank you so much for that. We will take a couple of solidarity messages, just 2 of them. I want to start with UNICEF, and I'm going to call on the representative from UNICEF, who will be speaking on behalf of all the development partners of the NHIA. Can we have the UNICEF representative here with us, please. After which, we will hear from the representative from Rush, so our main sponsor for today's event, and then we will hear from our special guest of honor. UNICEF, please.
Thank you very much. Her Excellency, Mrs. Rebecca Akufo-Addo, First Lady of the Republic of Ghana, the Chairperson, Niyohene Nuno III, representing Gahamante, members of Parliament here present, the Honorable Dr. Ajiman Manu, Minister of Health, Board Chair of the NHIA, Dr. Kwarko, and Chief Executive of the National Health Insurance Authority, Dr. Chane Selby. Other representatives from development partners here today, and ladies and gentlemen, all protocols observed, good morning. My name is Fiacre Makasi. I'm the Deputy Representative for UNICEF, and on behalf of UNICEF, it is my pleasure to participate in the launch of this NHIS Week for 2021, and among development partners, to have the opportunity to express our solidarity and appreciation and ongoing support for the strategic work and meaningful work of the NHIA. This is indeed an important week for the NHIA, providing not only the opportunity to consolidate efficiencies in the NHIS, but also to drive expansion and coverage, while also advancing the broader government priority on digitization. In this progressive vein, I would like to contribute 4 small reflections relevant for development partners, including UNICEF. The first one, of course, is to congratulate the NHIS in making significant progress to improve access to healthcare for all Ghanaians, including through its continuous efforts to simplify processes that make access and provision easier for both healthcare clients and providers. For example, the NHIS service package has been expanded to cover new areas in line with the existing disease burden and prevalence of inequities in Ghana. 2 illustrative and commendable actions today is the expansion of the service package to cover the treatment of childhood cancers and the provision of family planning services. Also, the increased use of electronic systems to pay claims to providers is making it easier to vet claims and to make prompt payments, and this not only increases efficiency, but also trust in a robust and responsive system. Similarly, the continuous awareness-raising efforts of the NHIA has ensured that 52% of the population remain active in the NHIS database, consolidating gains made in prior years. Secondly, and here I would like to emphasize the obvious, the NHIS is critical to achieving Ghana's universal health coverage vision. And NHIS is indeed the bedrock for addressing inequities in access to services that otherwise risk the health and prosperity of individuals and communities. Ghana's vision for universal health care is that all peoples in Ghana have timely access to high-quality health services, irrespective of the ability to pay at the point of use. And this goal clearly cannot be achieved without the NHIS. Certainly, there is significant work ahead to reach the level of coverage foreseen in the UHC, a target of 80% of the population which would be active on the NHIS registry. Then there's also the critical role of the NHIS to stem healthcare costs and bridge the equity gap on access to health services, which is recognized in the National Roadmap towards UHC. This assumes that achieving greater coverage, achieving that target, should enable an overall reduction in the cost of healthcare for patients and the gradual elimination of out-of-pocket expenditures. And this is indeed a worthy contribution to national development. Thirdly, and on the same point, the NHIS's work to continuously expand its coverage to reach categories including the indigents, I think is critical to leave no one behind, this lofty SDG goal. Over the past few years, the NHIS has worked to further strengthen the connection between the LEAP program, the GHS, and the NHIS itself through updated intersectoral protocols, data sharing, and cooperation at the decentralized level, and this has begun to show impressive results. Nationally, there has been a 6-fold increase in LEAP participants' enrollment onto the NHIS since the start of the initiative in 2020. And there are further opportunities to explore how to sustainably and efficiently increase coverage of the poorest by linking the NHIS to other national data systems, including LEAP, the Ghana National Household Registry, and the GHS tracker. Lastly, with development partners, UNICEF stands by our individual and, of course, collective commitments together with others to support the NHIS at all levels, and in particular through the health and social protection networks of collaboration, including at policy, planning, and implementation levels. Recently, the government of Ghana and health DPs are working together towards achieving a shared vision for a healthy population for national development against joint accountabilities set out in an aid memoir signed by all DPs following the 2021 Health Summit and business meeting with DPs. We look forward to continue working with the NHIA in expanding the NHIS service package to include areas highlighted in the aid memoir. For example, screening for non-communicable diseases, a stronger focus on preventative services, and setting up a well-functioning and sustainable health fund to cater for health workers not covered by the NHIS. We also look forward to supporting the NHIS to continue to strengthen linkages with other social protection programs and systems in order to further extend coverage to the poorest and create efficiencies through referrals and interlinkages of national data systems. So thank you very much for this opportunity to voice our support for the NHIA. And once more, congratulations on this NHIS week. We wish you continued success. Thank you very much.
Many thanks, Mr. Makase, speaking for UNICEF and on behalf of all the development partners of the National Health Insurance Authority. At this point, we'd like to say thank you to our sponsors, Top Archive, CalBank, Broad Spectrum, JPPL, DocuPro, InnoLink, Margins Group, Despite Media Graphic, Supertech Limited, Backpress, Farm Access Foundation, and Roche, who are a major sponsor and who will have to give us a solidarity message, the head of Access, Policy, and Government Affairs at Roche. Let's welcome Mr. John Clue for the second solidarity message. This event is live on YouTube, on NHIS TV, and also live on Facebook. So tell a friend. It's what's happening here at the conference center. Mr. Clue.
Thank you. Her Excellency, the First Lady of the Republic of Ghana, the representative of the Gamanche, the Honorable Minister of Health, the Board Chair of the NHIA, the CEO of the NHIA, distinguished ladies and gentlemen, good morning. Roche is honored to be a part of this celebration of the NHIA Week 2021, primarily because we believe that in our quest to achieve universal health coverage, all of us have a role to play. UHC for Ghana can only be achieved through public-private partnerships. And it's gratifying to note that when the policy on health was launched, it was one of the themes that was highlighted as an enabler to ensure that UHC is really achieved. For us, we believe that the economy of any country repeatedly has been demonstrated to be enabled by investments in particularly two key areas, in health and in education. And it appears Ghana is doing pretty well in these two areas relative to many other countries in the sub-region. I would dare say that one thing that COVID-19 has brought to the fore is the fact that we probably need to change our approach to healthcare as well. To now look at healthcare, particularly as an area of investment. Because it's a healthy people that deliver a healthy economy. And Roche is committed to ensuring that the people of Ghana continue to be healthy to deliver that healthy economy that we all desire. For us, being informed that the theme for this year's NHI Week was around linking the Ghana card to improving access to healthcare, we believe that this is a step in the right direction, because this is certainly an effort to ensure that efficiency is actually introduced in the healthcare sector that will long-term ensure the sustainability of the scheme, which we all potentially may be beneficiaries of. And so ensuring that the Ghana card is linked with healthcare provision under the NHIS is certainly a step in the right direction. As previous speakers have also said, it's very gratifying to note that today we are looking at, or we are on the cusp of ensuring that our children, those that we have for years called the future leaders, have a safety net, potentially, if they should come down with cancers. And like Dr. Setutu has illustrated, the challenges are so grave, but if you and I put our efforts together, the impact we can make will certainly even be better. And so for us, we are excited to be a part of the journey that would ensure that children with cancers have a greater chance to succeed in this country. We continue to be happy to support the government, to support the NHIA, to support relevant other stakeholders in ensuring that innovations are actually made available to the country, such that all of us achieve the kind of outcomes when it comes to healthcare that we desire. Because the truth is, today it could be somebody else without influence, somebody who has nobody to listen to him or her. Tomorrow it could be you, it could be me. And so there's a great responsibility on all of us, whether we're in public sector or we're in private sector, to see what we can do to support this attainment of achievements. Briefly, I was speaking with one of the board members of the NHIA, and he asked why Roche was doing things like this. And I mentioned that, one of the most frustrating things working for a multinational company is knowing that there are people in other parts of the world who don't bat an eye when they are diagnosed with a particular condition. Because some way, somehow, getting the care that they need is not a big deal. It's a bit frustrating to know that your medicines are saving lives in the US, in the UK, in other parts of Europe, and then somehow in parts of Africa, it appears you can only speak theory to the situation. So for us, it becomes only relevant when it comes to access, when we make these innovations also available. And so our commitment long-term is to ensure that innovations, whether it's therapeutic, it's diagnostic, whether it is with respect to modeling for financing or whichever other area, will remain available to support the system to ensure that it's delivered. We wish Ghana, we wish the NHIA the best of luck in this particular week, and you can rest assured that Roche has got your back. Thank you.
Many thanks, Mr. Klue and Mr. Mekese, for your solidarity messages. Well, the next speaker is only 8 years old. She wants to be a lawyer one day and also an ambassador for childhood cancers. Let's welcome to deliver a beautiful poem, Miss Brianna Fusua Adai.
For years, we have struggled. The cost of childhood cancer treatment far beyond our reach. For years, we have hoped. For years, we have prayed. For years, we have pleaded. Include childhood cancer on the National Health Insurance Scheme. Today, what was merely a dream is becoming a reality. The hopes and dreams of the entire childhood cancer family coming to life. Thank you, pediatric oncology staff and associates all around the country. Our voice has been heard. Thank you, Mama Rebecca, our own sweet mother. We thank you for always pushing the childhood cancer agenda. Thank you, National Health Insurance Scheme. Today, we can smile. Cure is finally within the reach of every precious child. God bless all of you. Thank you.
Thank you very much, Brianna. And just to let you know that Brianna, who just delivered the poem, and the other young lady who, Anita, who delivered the bouquet to the First Lady, are both survivors of childhood cancer. Let's put hands together for them. Wonderful. We'll now take a spot of music, and then we'll bring on our very special guest of honor. I'd like to bring onto the stage to perform for us the very, very talented cultural troupe to do their thing for us right now. Let's welcome them with a big round of applause. Adishima Dance Ensemble. Ladies and gentlemen, let's rise to welcome our very special guest of honor for today's event, Her Excellency, the First Lady of the Republic of Ghana, Mrs. Rebecca Akufo-Addo.
Good morning, everyone. Please sit. The chairperson, Ni Ahene Nunu III, Abula Manche, who is representing the Ga Manche. The Honorable Minister for Health, Kwaku Ejimamenu, Ministers of State, members of Parliament here present, members of the Diplomatic Corps, Board Chair and members of the NHIA, CEO, Deputy CEOs, management and staff of the National Health Insurance Authority, development partners and sponsors, Nime, Name, invited guests, ladies and gentlemen. I am pleased to be the keynote speaker at the launch of the second NHIS Week celebration. Let me begin by congratulating the management and staff of the National Health Insurance Authority for the substantial progress made since 2003. Indeed, I am encouraged by the numbers who are joining us today to celebrate the successes and achievements made in providing healthcare financial risk protection for Ghanaians. In 2017, I made a commitment to build a hostel at Kolebu Teaching Hospital, where children undergoing cancer treatment can stay with their families. Without this hostel, many patients may abandon treatment due to the cost of travel and other expenses. I am happy to say that last week I commissioned the Sunshine House, a 54-bed hostel, the first of its kind in Ghana and the biggest in Africa. So you can well imagine how excited I am now. Today is another milestone in the fight against childhood cancers. Step by step, piece by piece, we are getting there. For several years, many of us have been advocating for a critical look at how we address the challenges of childhood cancers. One major area of concern for many stakeholders was the financing of treatment, which placed a huge burden on families. Indeed, during the commissioning of the Sunshine House, speaker after speaker called for the inclusion of childhood cancers to the NHIS benefit package. Today brings hope to our children and their families. Distinguished ladies and gentlemen, I am extremely excited to announce that the NHIS benefit package now includes 4 childhood cancers, namely Burkitt's lymphoma, acute lymphoblastic leukemia, Wilms tumor, and retinoblastoma. As I understand, these constitute about 60% of childhood cancers seen in Ghana. Indeed, this is a major intervention in the fight against childhood cancers. Let me commend President Nana Addo Dankwa Akufo-Addo for directing the NHIS through the Ministry of Health to add childhood cancers to the NHIS benefit package. Let me also express my profound gratitude to the Chief Executive of the NHIA for leading her team to expand the current NHIS benefit package to include these 4 childhood cancers. The addition of childhood cancers to the NHIS benefit package is essential. It is cost-effective, feasible, and can improve survival of children with cancers. Certainly, our children deserve to live long, productive lives to enable them compete successfully with other children in the world. It has taken many years of advocacy, investment, and great leadership to bring us to today's incredible announcement. Kudos to all who have worked tirelessly to make today possible. I am also excited that Cape Coast, Tamale, and Ho teaching hospitals are starting oncology services. This brings the treatment of cancer closer to home for more Ghanaians. But we still have a lot of work to do as a country. We must institute awareness of early detection to increase better outcomes for our children. This calls for systematic and comprehensive education targeting communities, educators, health personnel, religious organizations, politicians, NGOs, and many others. Education must also set cancer control as a priority health agenda for the general population. Our people need to know the avoidable cancer risk factors, such as environmental carcinogens, tobacco use, alcohol abuse, and infectious agents. Ghanaians need to be empowered to stay healthy. Distinguished ladies and gentlemen, I wish to talk about one area in the continuum of care for children with cancers. That is a difficult subject for us all, palliative care. Sadly, some children will succumb to cancer. In such situations, we still need to ensure quality and dignity of life for our children. We need to have centers dedicated to making life bearable for terminal patients, where we can also provide psychosocial support for affected families. Discoveries that advance cancer care and cure are possible because of scientific research. We need to equip and support our research institutions and researchers, including those who research into herbal medicines, to improve our country's capacity to treat and manage cancers. We should aim to develop more effective treatments and treatments that have less side effects. Distinguished ladies and gentlemen, after a successful pilot project on family planning in some selected districts and regions, I am delighted again to announce the inclusion of family planning to the NHIS benefit package from January 2022. Certainly, this will help to improve our maternal and child mortality outcomes. The good news continues. As of today and throughout the one-week NHIS celebration, all Ghanaians who register or renew their NHIS membership will enjoy automatic activation. This means no waiting period. You can start using your card as soon as you register or renew. I hope the NHIA will benefit to roll out, I hope NHIA will continue to roll out interventions that will make healthcare truly accessible to all Ghanaians. Over the years, with the support of experts like your good selves, the international community, and development partners, we have grown Ghanaians' indigenous initiative into a remarkable social protection model in Africa. But our ultimate goal as a country should be universal health coverage for all Ghanaians. This means more innovative measures to ensure the NHIS is felt by all as a reliable social safety net. We need to enroll more people and provide improved health care delivery on a sustainable basis. We should continue to create partnerships drawing on the expertise and capacities of partners from different disciplines and sectors. To everyone, to every institution, to every sector involved in the fight against childhood cancers, I salute you. On that note, I wish you all a successful 2021 NHIS Week celebrations. I thank you.
Thank you, Madam First Lady, for your keynote address and for launching this year's National Health Insurance Scheme Week. We will take closing remarks from the representative of the Gamanche, who's here with us. Let's welcome back onto the stage the Atufo Chair of the Gas State, to help us with the closing remarks. Let's welcome him, please. Ni Ahene Nunu III, Abula Manche.
I would like to thank the Almighty God for making this program a success today. I'll continue to thank Your Excellency, the First Lady, Mrs. Rebecca Na Okanko Akufo-Addo, for giving us the keynote for today. I'll then thank each and everyone that makes it possible for today's occasion, especially the coordinators of this NHIA. I would like to thank everyone on the stage for taking their time and making this program a success as well. I think we've learned a lot from our documentary, from the people that spoke earlier, the doctors, and I think we're going to stay long. Because with everything that has been said, you can be diagnosed early with the NHIS by visiting your hospitals and making sure that we have a healthy family. I would like to thank the media as well, and thank Anime and Name that made it also possible to this occasion. With all said and done, I would like to thank the President of the Republic of Ghana, Nana Akufo-Addo, His Royal Majesty, King Takite Kochulu II, and lastly, God bless our mother Ghana. Thank you.
Thank you, Ni Chairman. I want to now call on Dr. Justina Asafwe-J. She is with the Quality Assurance Directorate of the NHIA for the vote of thanks.
Our special guest, event chairman, Honorable Health Minister, Ministers of State and honorable presence, board members, distinguished ladies and gentlemen, good afternoon. I deem it a great pleasure to be asked to propose the vote of thanks. I'll begin by giving all glory to God Almighty Allah for making today's occasion a resounding success. We are extremely thankful to our special guest, the First Lady of Ghana, Her Excellency, Mrs. Rebecca Akufo-Addo, for honoring our invitation to be part of this program. Despite her busy schedule, she found time to grace this occasion. We have witnessed over the years her contribution to the health matters in Ghana. We believe your love for mothers and children will always bring you home to the National Health Insurance Authority, Ma'am. We thank you for your kind words and your interest in the progress of the National Health Insurance Scheme. Ni Ahene Nunu III, Abiola Manche, our event chairman, we are truthfully grateful for stepping in for the Manche, who we know that would have loved to be with us today, but couldn't. You've made this occasion a smooth program. Our Honorable Minister, Mr. Kweku Agyeman-Manu, we are honored to see you here as well. Your sacrifice and continued effort have not been lost on us. May God continue to strengthen you. Respected Board Chairman, Dr. NSKP Kwaku, we are grateful for your words of encouragement. Your able guidance have encouraged us to work harder. Our heartfelt thanks to the CEO of the National Health Insurance Authority for her valuable contributions and guidance to the development of the authority. Dr. Lydia Baba Jan Selvi, may the perpetual love of God continue to protect you for us. We owe a special gratitude to all our Deputy Chief Executives, Mrs. Ya Pokia Bading, responsible for Admin HR, Mr. Francis Owusu for Finance and Investment, and Mrs. Vivian Adokobia for Operations. God bless you all. I thank all distinguished invitees present here for accepting our invitation to be part of the program. To our sponsors, for everything you've done for us in the past, everything you still do and will continue to do, we at the Ghana National Health Insurance Authority want to let you know that we are grateful and we look forward to a prosperous future together. I would like to take this opportunity to extend our most sincere thanks to the members of the media for their interest to cover the event and all good hearts that worked behind the scenes. We are grateful for your contributions. Last but not the least, we thank all staff of the authority for your cooperation in making this function a great one. Ladies and gentlemen, an event like this cannot happen overnight. To the organizing committee, I say Ayuko. This is just the beginning of great things planned for the week. Mr. Chairman, ladies and gentlemen, we are in this together. Thank you all for coming.
Thank you, Justina. And before the closing prayer, just to make an announcement that we'll take our official photos on the stage with our VIPs and the First Lady, and we'll have board members and executive management join them. So it'll be one photo of our VIPs and the First Lady, and then they'll be joined by the board members and the executive management for that second photo on the stage. After the closing prayer, which will be said by Deputy Director at the Research, Monitoring and Evaluation Directorate of the NHIA, let's welcome Abbas Suleimana.
Thank you very much. Please let us be in the prayer mood. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين إياك نعبد وإياك نستعين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين.
Thank you very much. Brings us to the end of the launch of the NHIS Week for 2021 on the theme NHIS, using the Ghana card for expanding access to healthcare. And if you were listening very carefully, you would have remarked that the First Lady made a comment about that waiver. There's a waiver, so if you're renewing your membership, that waiver is for that time period that you'd have had to spend waiting, but no longer. It's going to be immediate. So you need to renew your membership this week or jump onto the system this week, and that waiver affects or impacts you. So remember that that's the great news you want to take away from today's event. Thank you very much, all of you, for coming here. We're going to have our official photos right now. So respectfully ask the First Lady and the VIPs to stand for a beautiful official photo. Board members and executive management, be on standby. You will join them for that second official photo, and we'll be done for today. Board members, executive management, please stand by. I need you up here right now to join them for the photos. Board members, executive management, please join our VIPs on the stage. We take a photo, official photo. Board members and executive management, please join them. Please come up on the stage. This event was live on YouTube and on Facebook NHIS TV on YouTube, and NHIS on Facebook. We have a photo exhibition outside, so please make sure when you step out, move towards the right and check out what we have for you from the National Health Insurance Authority. Let's make this photo snappy, please. Snappy, snappy. Thank you very much. Thank you, photography. Thank you. Thank you, Madam First Lady. And she will now depart. We're wishing you a very good day. Remember to check out the photo exhibition when you step out of this auditorium. See what the NHIA is doing. Remember, the waiver exists. If you're joining the system, this is the time to do it. If you're renewing your membership, this is the time. The waiting period has been waived off. Immediate access to NHIS. Can we lower the music a little bit? Lower it a little. Eddie Shiman, low, small for us. Thank you. Boko, like that. Thank you. The First Lady will now leave us, will depart from us. Thank you very much. Enjoy the rest of your day. Bye-bye. Enjoy your day. Make sure you check out the photo exhibition. My name is Kafui Day. This has been the launch of the NHIS Week. NHIS, using the Ghana card for expanding access to healthcare. Have a good day. God bless.
With the prison man, we don't lose Tarado, Obiniema, I'm coming alone, Lima Mushishobi, Makamasa Machila Lupo, Minyobia, Monteo, Pasemi, Camille alone, Lima Mushishobi, Obi, Mabamunyu machila nupo maminyobia, minyobia, mote, adubu wilanyanga. Erade nyanga. Adubu wilanyanga. Erade nyanga. She, wokuyanda sustili yewu. Wasro kwaswana kube musu. We make DJ adan mosu. We steady midama su still won't. Shadi wandu. Amiti wandu. And I did the same. I have it that I want it one day.
My baby, my Valentine. You know you do make you a temperature difference. If you leave me a good time, I swear. You are like the oxygen I need to survive. I'll be honest. I love it, they don't me. I am so obsessed. I want to chop your heart. Never did it back at this feel. But now make us feel. Yeah, my love one thing. Me make a bad man sing. I go spend for your head. Talk all they want, I don't care what they say, cause your matter. Now him I con the carry for my head every night. Now you I want the carry to my bed. Oh no no, don't tell me no no no. You can be my partner, never ride it solo though. And we got no one lucky, no need to party wo. I feel it what you're doing, know ya baby, gotta go, gotta go. Your body they back at me, sweet. Open up, make us